Welcome everyone to this next installment of the Inner Source Health webinar series. Today we've got Dr. Victoria Liotta talking a bit about acupuncture theory and some of the practical uses of acupuncture in our clinic. My name is Dr. Robert Kochko, and it's a pleasure to introduce Dr. Liotta. Victoria Liotta is a doctor of acupuncture and a New York State licensed massage therapist. She holds a BA from Villanova University prior to earning her doctorate in acupuncture from Pacific College of Chinese Medicine. Dr. Liotta's goal as a healthcare practitioner is to utilize her knowledge to help those with challenging health conditions, but her philosophy is simple: take care of yourself now. She considers herself a general practitioner of acupuncture. However, most of her patients present with pain of the body, limbs, or head. Dr. Liotta also has experience in the specialty of psychological and emotional health, frequently helping those with anxiety. Patients respond well to her attentive demeanor, knowledge, and technical expertise in acupuncture. And if you've got any questions, feel free to share them in the question box or in the chat box, and we'll go through those at the end. So without further ado, Dr. Liotta, take it away.
Ni hao, and hello, and welcome to Acupuncture, a little bit of theory. Today I'm going to be discussing the basics of acupuncture and the principles behind it and some common conditions that I treat often. This webinar will be good for those who have had acupuncture, maybe have not had acupuncture, but are interested in acupuncture and its principles, and also for practitioners who are looking to find a simple way to explain acupuncture to their patients. So we all know, or most of us know, that acupuncture began in China about 2,000 to 3,000 years ago. And back then, the Chinese didn't have the sophisticated instrumentation and machinery to look at the body as we do today. But they sensed there was something that gave us our vitality that they didn't necessarily see. And you've probably heard of what I'm going to mention in a moment, and what they sensed was qi. So qi, basically vital energy, life force. Those of you who've done yoga and are familiar with the chakra systems might know of this energy as prana. That's from India. The Chinese, and in Chinese medicine, we refer to this life force or energy, loose translation when I say energy, as qi. Qi's very light, it moves through the body, and it has an intelligence to it. And I say it's intelligent energy because it instructs the systems of our body to work properly and do the functions that they need to do. And they work together, the systems of the body. But they need the energy, just like the heart needs the energy to pump blood, our lungs need to expand, we need energy for our digestion. So there's different types of this intelligent energy, or qi. And some of the common different types of qi are da qi, which we get from the air that we breathe in, gu qi, which is from food, which helps us break down the food that we take in and transform it into nutrients. And also, in Western sense, you could say the gu qi helps to move the food through the digestive tract through peristalsis. There's also another type of qi called wei qi, which is defensive qi or protective qi. And it's found below the skin, just at the surface of just below the surface of the skin, and it protects us from disease and outside pathogens. In Western medicine, we'd say that's our immune system. Now, there's something related to qi, which is called jing or essence. And it's the energy, or the pot of energy we like to think of, that we're born with and we use throughout our lifetime. And as we get older, or as we go through age, we tend to lose this jing little by little. But a poor lifestyle, a lifestyle without proper sleep, nutrition, exercise, or even too much activity and excesses can diminish this jing or essence. Even those that have had, women who have had many, many births, pregnancies, tend to lose a little bit more jing just because of the birthing process, and we can understand that. And this jing or essence can be developed more or actually restored through practices of Tai Chi and Qigong. So how does Qi get through the body? It circulates the body in what's known as channels or meridians. Some of you might have heard of meridians of the body, and each of these channels run up and down our arms, legs, through our torso, back, face, head, and they circulate Qi, just like water runs through a river. You can think of the channels or meridians as rivers running through our body. So Qi is the channels as water is flowing through a river. And each channel, each of the primary channels, I'm only going to talk about the primary channels. I don't want to get too advanced. This is just a basic class. But each channel is associated with an organ. You have a lung channel, which runs through the arm, kidney channel, stomach channel, liver channel, and so forth. And the channel is named by the organ, as I said. And acupuncture points, where we actually do the acupuncture, the needling, most of the points are found on these channels. So let's see if I could go back to that diagram of this figure here, where you see the lines, those are the channels or meridians, and the spots on this diagram are the acupuncture points, where we actually put the needles in most cases. Now, there are distal points and local points. And I bring this up because many people will say, I have a stomach ache. Why are you putting a needle down by my toes? That's considered a distal point. And with that stomach, the stomach channel actually runs from the face down to the toes, but in its path, it goes through the stomach. So I'm able to use points away from the stomach to clear the channel to help heal the stomach. Many of these points, the most powerful points on the body, are found below the elbows and below the knees. So that's why I brought up a point at the very end near the toes. Okay, but I hope that makes sense. It's actually the channel connection that helps you heal by using points away from the site of the ailment or pain. There are some exceptions. There's special points that aren't on channels. Those are usually associated with a specific function or an organ. And there's also something called Assure points, which are points when someone palpates or presses into an area, you might feel some pain, there might be a knot or a trigger point there, and we can treat the pain, especially the pain, using these Assure points, which are points outside the traditional channels. So I want to talk about common patterns, or before that, talk a little bit about how acupuncturists come up with a diagnosis. It's different than Western medicine in that we look for a pattern in the body. And the first pattern I want to talk about is stagnation. So let's think back to those rivers that are like channels that flow through the body. And you have Qi flowing through the meridian or water flowing through the river. And everything's fine. You're feeling good, feeling healthy, no pain in the body. But let's say there's a blockage in that river. You get to a point where there's a lot of rocks, boulders, there might be a tree that fell down, there's a blockage in the channel. We consider that blockage in acupuncture stagnation. So we want to remove that stagnation so everything can flow, okay? Because where there's stagnation, an old Chinese adage is, there is pain. When there's no stagnation, there is no pain. Okay, so that's just speaking of pain, but I want to talk about that river again when it comes to another common pattern. Let's say you have the river, it's flowing fine, it's clear. It comes up to a point where it's a little mucky, it's a lot of silt, almost like the Mississippi, if anybody's been to that area of the country. It's a lot of mud in the river, let's say. Heavy, cloudy. We look at that as dampness in the body, or even phlegm. There's a heaviness, swelling. So that dampness actually can manifest in different parts of the body. Most commonly as mucus in the lung, but you could also have mucus in the digestive tract. It's all dampness. You could have swelling in the legs, Or you could even have a cloudy feeling in your head, like a dull kind of headache. So we want to treat that dampness, and we'd say, well, dampness is causing this ailment the person's coming in with. Another common pattern is rebellious chi or counterflow. The river's not flowing in the right direction. Think of acid reflux when it comes up, like GERD. It's going the wrong direction. It shouldn't be flowing upwards towards your mouth. We want to redirect it. With that acid reflux, we can have heat. It feels hot many times, so there could be heat within the channel. And commonly, heat presents as fever, redness, or inflammation. So we could treat all these conditions, like fever or inflammation, by clearing heat often. Also, there could be cold, say cold in the channel. And a common symptom is the person likes warmth. They could say, oh, my lower back hurts, but when I put a nice heating pad on it, it takes away the pain. A symptom of cold would be clear mucus when you have a common cold. If there's yellow mucus, we would say there's more heat in the body. We would want to clear heat. So I just wanted to bring that to everybody's attention. So here's a chart of diagnosis, or diagnosis meaning we have the pattern and what we do. How do we treat the pattern, which is causing the condition the person's coming in for acupuncture? We talked about stagnation. In stagnation, we want to remove what's the blockage is, so we move chi and also blood. Heat, simply we want to clear heat. Cold, we want to warm the area. Dampness or phlegm, we want to drain dampness. If there's phlegm, which is more congealed dampness, we want to transform the dampness and then, transform the phlegm and then drain the dampness. Now, all these can be considered excess conditions or excess patterns. When I mean excess, there's something there that doesn't belong in the body, like too much heat or dampness or even that stagnation. So with excess patterns, we want to reduce, take away what doesn't belong. Now, let's say there's a weakness in the body, like a weakness in a meridian or more specifically an organ, like let's say the lung or the stomach. We want to build up that organ, and we call that tonifying. Okay, so with excess, we want to reduce. Deficiency, we tonify. This is just common verbiage that we use in acupuncture. Now, before we come to a complete diagnosis, part of it includes looking at the tongue and feeling the pulse. But most importantly, when someone first comes in, you need to know their chief complaints. So before we could diagnose and come up with a pattern and then a treatment principle, we want to know what brings you in. How could I help you? And we ask questions related to the signs and symptoms and also the other areas of the body in order to come up with a complete picture. And we use the tongue. We look at the tongue because the tongue gives us an indication of what's going on internally in the body. It's a muscle and also internal. So if you look at this chart here, this picture, you'll see there's a section for the heart and the lung that's at the front of the tongue, just like the heart and lung are at the top of the body, the top of the torso. At the sides, you have the liver and the gallbladder. Liver and gallbladder are actually on the right side of the body, but we also look at the left side of the tongue to see if there's something going on with the liver. Stomach and spleen in the center, and so forth. The kidney, bladder, intestines being the lower part of the torso, being in the back of the tongue. So this is how we come up with a picture and a diagnosis in order to treat. Now, no discussion on acupuncture can be complete without a discussion on yin and yang, and I'm going to cover this quickly. Going back to the ancient Chinese, they didn't have machinery to see things the way they didn't have telescopes and all the sophisticated machinery to look at their world. So they basically looked around and saw the daytime is bright, there's a nighttime that's dark. They assigned the daytime to the yang, which is bright, active, a lot of activity going on during the day. We do work, we take care of our children, we go to school, we shop. A lot of activity, mostly during the daytime, tends to be warmer. And I put here above, things that are above, they say the sky and the heavens are considered more yang than things that are yin, which are below and assigned to the nighttime when it's dark. Static, because there's less activity, so things that don't move are more static and solid are yin, and they tend to be a little cooler or cold. If we look at this picture, it's the Tai Chi symbol, we see the yin and yang, the yin being the dark side, the white side being the yang. But there's also a spot in each. There's a yin within yang and a yang within yin. Again, and this represents that not everything is purely yin or yang. Many times people say, well, yang are men, yin, women. True to a certain extent, women tend to be more yin because they're nurturing. Men tend to be more yang because they tend to be more active. But if you look at a mother who's nurturing her child in a very yin fashion, that same mother, if she needs to protect her child, can be very yang. And just like men could have their nurturing side too. So nobody's completely yin and yang, yin or yang, and things tend to be a mixture of both, or more importantly, we'll say something is yin compared to something else that is more yang. And going back to the above and below, an example of that would be the ceiling is yang compared to the floor, which is yin. And we want yin and yang to be not so much perfectly balanced, but in harmony, where they work together, they complement each other. I want to talk about yang deficiency and yin deficiency quickly. This gets a little confusing. It's good for students who are studying acupuncture to understand this. Yang deficiency means there's not enough yang. There's not enough yang. So if yang is warming, there's not enough warmth. So therefore, the person's going to have cold signs. They're going to feel cold. They're maybe going to be wearing a coat when it's a warm day. Their hands might be cold, their feet, lower back gets relief from heat, like we said. Or you could be yin deficient, where there's not enough yin. Therefore, you have heat signs. Okay, a perfect example is as women age, we tend to become less yin. Especially during menopause, we experience heat signs such as night sweats, hot flashes, irritability, and insomnia. Okay, so let's talk about some common conditions. I mentioned someone could come in with a condition, but we have to find a pattern in order to treat effectively. Headaches are a perfect example because 3 people could come in with a headache from 3 different reasons. So one person might have been in a car accident, they had an injury. That usually is stagnation. We're going to want to move the qi and blood, like I said earlier. Or that headache could be a heavy feeling, a fogginess, that we attribute to dampness or phlegm. So we want to drain the dampness. If it's dull, usually they have fatigue, maybe not, but there's usually a deficiency. Something's not strong enough. So we want to build up the organ that's deficient. We also look at the location of the headache and its associated channel. For example, the back of the head, the occiput. Many times people have headaches in the back of their head from neck tension. The bladder channel runs through the back on either side of the spine, up through the neck and into the head, skull. So we would want to clear stagnation along the bladder channel too, and use points on the bladder channel, also the gallbladder channel. Another common condition, I had mentioned lower back pain. Injury again, stagnation, move qi and blood. There's a weakness, it's deficient. We need to build something up. If there's cold signs, the person likes warmth, probably yang deficiency, especially in an older person. Now I put kidney yang deficiency because the kidney is associated with the lower back and the knees, and also as we age along with the essence, we tend to lose kidney qi. So there could be a deficiency of qi also, or the essence or jing that we spoke about that we would want to try to build up, tonify. Stress, anxiety, and insomnia. I group those together because they tend to go together and are treated in similar fashions. When you have anxiety, you usually have problems with sleep. Same thing with stress. These are usually caused by a pattern called liver qi stagnation. Now we talked about stagnation, qi stagnation, the blockage in the channel. I put liver there too because it's commonly associated with stagnation of liver qi, because the liver controls the flow of qi in the body. So in this case, we want to soothe the liver and move qi, okay, and use points that would do that. The heart's also associated with anxiety. If there's either a deficiency, sometimes even heat in the heart, we could have palpitations, could affect our sleep by having vivid dreams, so we would want to either clear the heat from the heart or build up, tonify the heart qi. And I put yin deficiency in again because many times stress, anxiety, and insomnia are associated with the yin deficiency that goes hand in hand with menopause. And I think I have one more condition. I put asthma in because I wanted to put a condition that has to do more so with a deficiency of an organ. And I chose asthma. Asthma usually is a weakness or deficiency of the lung. So we want to tonify, build up the lung with using points on the lung channel primarily. Or there could be heat causing asthma, especially if it occurs from an allergy or developed later in life through, let's say, smoking, where heat has entered the lung channel. So we would want to clear heat from the lung. Shusha, thank you very much for listening today. I'm going to take a few minutes to answer any questions. But in the meantime, if you would like more information, you could check the website at innersourcehealth.com or follow me at InnerSource Eastern Medicine. And anyone who's interested in acupuncture or has specific questions they would like to ask me, feel free to call the office at this number listed here on the slide.
Great. Thank you so much, Dr. Liotta. That really brought back some memories from acupuncture school and was a nice refresher even for me, having gone through that program. The first question that came in is whether or not you treat cancer with acupuncture.
That's a very good question, an important question. Cancer is something that is outside the scope of practice for acupuncturists, at least in New York State and probably most of the country. But as an acupuncturist, I am allowed to treat the signs and symptoms associated with the treatments of cancer, treatments meaning chemotherapy, radiation therapy, because many times they have side effects. So if someone comes in and is very weak, tired, fatigued from the chemotherapy, has lost their hair, I will do a treatment to address that. Many times with cancer, I see people that come in with neuropathy of the limbs. I can do a treatment to help restore the function of the limbs to its proper function. But as far as specifically treating the cancer, it's outside of scope of practice, meaning it's not to be done by an acupuncturist.
So you're treating the person with the cancer, not necessarily the cancer itself.
Yes, thank you. Thank you for that clarity.
Sure, good. And another question just came in. It looks like one of the attendees has had group acupuncture, and they mostly had ear acupuncture, so the needles were all placed in the ears. Can you just clarify whether that's what you do, or if there's a difference between a full acupuncture treatment with you and more community acupuncture style?
Sure. The group setting is probably, it is what we consider community acupuncture, where you could come into a room and there'll be tables, not tables, but let's say chairs set up or desks set up, and it's you don't have to disrobe, you won't be in a private room, but it's used to help treat pretty much anything in the body using the ear. We call it auricular acupuncture. The ear is a microsystem of the body. When I say microsystem, I mean, it's it's a mirror, not even a mirror. It's system of the body that represents the whole. So the ear represents the whole body. And when we talk of the ear representing the whole body, we picture an inverted fetus, where the fetus's head is at the lobe, its internal organs are on the inside cavum, we call it, of the ear, and the arms and legs kind of curl at the top of the ear. And we would use fine, shorter needles in order to stimulate the points that are represented by the different organs or limbs of the body. And it's very useful in group settings. Like I said, you can treat several people without having to put them in a separate room or in a group setting. So I find it very effective for that. And I also will use some of the ear points in a private session also, along with body points.
Great, thank you. Time for one more question here. So, and if anyone else has any other questions, whether you're listening live or to the recording, feel free to give us a call or to email Dr. Liotta. The last question that we'll take here is if you can just speak a little bit more about the difference between qi and blood.
Sure. You know, I mentioned blood once during this presentation, and it would be difficult to talk fully about blood without more time. But qi is light, it's energetic, more energetic, and it's a yang substance, meaning it's more active and moving. The blood is considered a yin substance. So qi and blood go hand in hand. Qi is the yang, blood is considered more yin because it's thicker. Qi is considered the commander of blood, meaning it moves the blood through the vessels. Blood is the mother of qi, though, because blood gives qi its nutritive value. And blood we usually see reflected in the hair, skin, and nails. So many times when people start losing their hair, especially unexpectedly, I've seen this a lot with women, they tend to be blood deficient, and I will use acupuncture to tonify the blood and maybe suggest some foods that tonify the blood, such as beets and greens. So I hope that was complete enough there, but there could be a whole discussion on qi and blood.
Sure. Well, that might have to be a future episode of this webinar series. So on behalf of Dr. Liotta and the rest of the Inner Source Health team, thank you so much for joining. If you want to keep an eye out for future webinars, definitely sign up for our newsletter. We're always scheduling and sending out new exciting information. But also if you go to innersourcehealth.com and you click at the top, Keeping Up with ISH, you'll see the full events calendar for future webinars. Once again, thank you all. And if you do have any questions, give us a call, 631-421-1848, or feel free to check us out online. Any parting words, Dr. Liotta?
Oh, no, I would just say thank you. Another sure. I don't know if I'm pronouncing it right. I'm not very good with that. But thank you for listening today, and feel free to give a call with any further questions. I'd be happy to speak with people in more detail and personally.
Wonderful. Well, have a nice day, everyone, wherever you find yourself.